If you have CKD, you're probably already leaking protein in your urine or may develop proteinuria at some point. Today, we'll share with you the top herbal teas to help reduce protein loss via urine and prevent proteinuria, while helping to detoxify your blood and flush out waste products like urea and creatinine. We'll also tell you about how to prepare those teas, how many cups of either of those herbal teas you can have per day, the dosage if you're considering them in supplement form, and any interactions or side effects you should watch out for. Let's begin with the number one herbal tea on our list, green tea. Green tea is packed with several powerful antioxidants, particularly EGCG, epigallocatechin galat, which belongs to a group of antioxidants called catechins. For those dealing with diabetic nephropathy, EGCG can actually help reduce proteinuria and protect the tiny filters in your kidneys, slowing down damage from high blood sugar levels. If you've had an acute kidney injury, AKI, or any kind of renal injury, this compound has shown promise in reducing inflammation and supporting recovery by protecting kidney cells from further harm. Plus, EGCG can help combat hypertension and improve blood flow, which is a big deal for keeping your kidneys healthy overall. Now, let's talk about how much green tea to drink for these kidney health benefits. The recommended amount is about 3 to 5 cups of brewed green tea a day. However, too much of a good thing can be harmful. High doses of green tea, especially in supplement or extract form, can cause problems like liver toxicity. Plus, if you've got a history of kidney stones or currently have kidney stones, be cautious, as green tea contains oxalates that could increase your risk of having those stones back. Number 2. Dandelion tea. Dandelion tea is packed with several nutrients, especially B vitamins, vitamin A, vitamin C, and vitamin D, along with minerals like iron, potassium, and zinc. Together, these nutrients can help lower inflammation in your body, including your kidneys, protect your kidneys from any further damage, and may even help control other factors that contribute to kidney damage, particularly high blood pressure and high blood sugar. This, in turn, helps reduce proteinuria naturally. On top of that, dandelion tea's diuretic effects can help reduce swelling in your hands or feet caused by water retention, and flush out waste products from your body, including urea and creatinine. Dandelion leaves are often added to salads and teas, while their roots are dried, ground, and used for tea, or even as a coffee substitute. And well, if you're thinking about trying dandelion tea, drinking 2 cups of dandelion tea daily is generally considered safe for most individuals. It's important to avoid drinking more than that, mainly because dandelion tea has diuretic effects and contains potassium. Drinking 1 to 2 cups of dandelion tea is less likely to overload your kidneys with potassium, but it's wise to start with small amounts and consult a healthcare professional, especially if you're using it in supplement form, like capsules or extracts. People allergic to daisies, marigolds, chamomile, or chrysanthemums should be careful too. Dandelion might cause allergic reactions, stomach discomfort, diarrhea, or heartburn in some people. Number 3. Astragalus. Astragalus is an ancient herb that's been a staple in traditional Chinese medicine for centuries. It is known for its adaptogenic and anti-inflammatory properties, and it's gaining attention for its potential to help treat proteinuria. This herb works in several ways. For example, astragalus helps by reducing inflammation in the kidneys, which often leads to kidney damage. It also helps improve blood flow to the kidneys and strengthens the glomerular filtration barrier, the tiny filters in your kidneys that keep protein in your blood where it belongs. By doing this, astragalus not only helps lower protein loss via urine, but also helps to protect the kidneys from further harm. For those having diabetes, astragalus has been shown to help improve insulin sensitivity and reduce oxidative stress caused by high blood sugar. This is crucial for people with diabetes, as uncontrolled blood sugar is one of the leading causes of kidney damage and proteinuria. Studies suggest that astragalus can help lower fasting blood sugar levels and improve glucose metabolism, providing an extra layer of protection for your kidneys. For people with high blood pressure, Astragalus acts as a natural vasodilator, meaning it helps relax and widen blood vessels. This reduces the strain on your kidneys and improves overall blood circulation. By lowering blood pressure, astragalus not only reduces the risk of further kidney damage, but also helps prevent complications like heart disease, which often go hand in hand with kidney issues. Studies back that all up. For example, taking 7.5 to 15 grams of astragalus daily for 3 to 6 months has been shown to reduce the risk of infections by 38% in people with nephrotic syndrome, a kidney disorder that often involves proteinuria. Here's how you can make astragalus tea. Use 1 to 2 teaspoons of dried astragalus root, or leaves, per cup of water, or simply steep an astragalus tea bag for about 5 to 10 minutes. Drink this once or twice daily. For supplements, the typical dosage ranges from 500 to 1,500 milligrams of astragalus extract per day, but always consult your healthcare provider before starting. Now, let's talk about potential side effects and interactions. Astragalus is generally safe for most people, but it can cause mild side effects like diarrhea or allergic reactions in some cases. It's also important to avoid astragalus if you're on immunosuppressant medications, particularly if you've undergone an organ transplant recently. Astragalus might boost your immune system and counteract those drugs. Pregnant and breastfeeding women should steer clear too, just to be safe. Number 4. Nettle leaf tea. Nettle leaf tea is among the best natural herbal remedies to help improve kidney health and reduce protein loss via urine. It's packed with nutrients like vitamin C, vitamin A, and vitamin K, and minerals like iron, calcium, magnesium, and potassium. On top of that, it contains powerful antioxidants such as flavonoids, carotenoids, and polyphenols, which help your body fight against oxidative stress and inflammation and protect your kidneys from damage. One of nettle leaf tea's standout benefits is its ability to flush out toxins like urea and creatinine, which can build up when kidney function declines. It acts as a natural diuretic, increasing urine output by up to 30% according to some studies, which not only helps detoxify the blood, but also prevents edema. The swelling caused by fluid retention. For those with high blood sugar, nettle leaf tea can help regulate glucose levels. It also plays a role in lowering blood pressure by relaxing blood vessels and improving circulation, further reducing stress on the kidneys. To make nettle leaf tea, steep 1 to 2 teaspoons of dried nettle leaves, or 1 tea bag, in a cup of hot water for about 10 minutes. You can drink it 1 to 2 times daily. If you're new to nettle tea, start with 1 cup a day to see how your body reacts. For nettle leaf supplements, the typical dose ranges from 300 to 600 milligrams of nettle extract per day, but always consult your healthcare provider for personalized advice. Nettle leaf tea is generally safe, but it can cause mild side effects like stomach upset or allergic reactions in some people. Its diuretic effect means you'll urinate more, so stay hydrated. Avoid nettle tea alongside your medications, especially if you're on blood thinners, as its high vitamin K content can interfere with them. Number 5. Hibiscus tea. Hibiscus tea is a gorgeous ruby red herbal tea made from the dried petals of the Hibiscus sebderifa flower. It's tangy, slightly tart, and loaded with health benefits. It is packed with some very powerful antioxidants like anthocyanins, polyphenols, and flavonoids. These compounds not only give it its vibrant color, but also play a key role in protecting your body from oxidative stress and inflammation. Hibiscus tea is a natural diuretic, meaning it helps your kidneys flush out toxins like urea and creatinine by increasing urine production. This makes it a great choice for supporting kidney health and even preventing edema or water retention. In fact, studies show it can boost urine output by up to 30%. Plus, it may be really good for your heart. It's been shown to lower high blood pressure by relaxing blood vessels and improving circulation. If you're dealing with hypertension, hibiscus tea could help bring those numbers down by 7 to 10 units. And for those managing diabetes, hibiscus tea can help regulate blood sugar levels, reducing the risk of kidney damage caused by high glucose levels. Making hibiscus tea is super easy. Just boil 1 to 2 cups of water, toss in 1 to 2 teaspoons of dried hibiscus petals or a tea bag, and let it steep for about 5 to 10 minutes. Strain it and you're good to go. You can enjoy it hot or iced, and if you like a little sweetness, a dash of honey or a squeeze of lemon pairs perfectly. As for how much to drink, 1 to 2 cups a day is a safe amount for most people. If you prefer supplements, hibiscus is available in capsule or extract form too. The typical dosage ranges from 250 to 500 milligrams per day, but always follow the instructions on the label or consult your doctor, especially if you're managing a chronic health condition like CKD. Number 6. Ginger tea. Ginger tea may be particularly good for kidney health. It helps by reducing inflammation and oxidative stress, two factors that can contribute to kidney damage. For people dealing with proteinuria or chronic kidney disease, ginger tea may help protect the kidneys by improving blood flow and supporting detoxification. It has been shown to help flush out toxins like urea and creatinine, which can build up in the body when kidney function is impaired. Plus, its mild diuretic properties can help reduce water retention and prevent edema. Ginger tea also supports blood sugar control if you have diabetes. And if you have high blood pressure, ginger tea may help by relaxing blood vessels and promoting blood circulation, preventing kidney damage due to high blood pressure. Making ginger tea is simple. Slice about 1 to 2 inches of fresh ginger root, add it to 2 cups of boiling water, and let it simmer for 10 to 15 minutes. Strain it and enjoy. You can add a bit of honey or lemon for extra flavor. If you're using powdered ginger, about 1 teaspoon per cup works well. Aim for 1 to 2 cups a day to enjoy its benefits. If you prefer supplements, ginger is available in capsules, extracts, or even gummies. The typical dosage ranges from 250 milligrams to 1 gram per day, depending on your needs. But always check with your doctor, especially if you're taking medications for blood pressure, diabetes, or blood thinning, as ginger can enhance their effects. While ginger tea is generally safe, it's best to avoid excessive amounts, as it can cause heartburn or stomach upset in some people. People with gallstones should also be cautious, as ginger can stimulate bile production. Number 7. Horsetail tea. This herbal tea is often used and considered particularly effective against fluid retention, urinary tract infections, kidney and bladder stones, and even urinary incontinence or the inability to control urine, like what happens in an overactive bladder. Puis. It's a natural diuretic. It helps increase urine output, which supports the kidneys in flushing out excess toxins like urea and creatinine. This makes it a great option for people with kidney disease or those trying to maintain healthy kidney function. Horsetail's diuretic effects can also help prevent water retention and reduce swelling, which is important for those with edema or high blood pressure. Speaking of blood pressure, horsetail tea can help regulate it. The plant has even been shown to have a mild antihypertensive effect, meaning it can potentially reverse high blood pressure. To prepare horsetail tea, simply steep 1 to 2 teaspoons of dried horsetail leaves in a cup of hot water for about 10 minutes. Strain the tea, and it's ready to drink. You can enjoy it up to 2 to 3 cups a day. If you prefer supplements, horsetail is available in capsules or extracts, with a typical dosage of 300 to 600 milligrams per day, but always follow the manufacturer's guidelines. Since it's a diuretic, it can cause dehydration if you're not drinking enough water, so make sure to stay hydrated. It's also important to note that horsetail can lower potassium levels, so if you're taking potassium-sparing medications or have low potassium, consult your doctor first. Number 8. Parsley tea. Parsley is often used as a garnish, but its medicinal properties have been recognized for centuries. It's loaded with vitamins A, C, and K, as well as folate, iron, and antioxidants like flavonoids and carotenoids, all of which contribute to overall health. When it comes to kidney health, one of its standout properties is its natural diuretic effect. Parsley helps increase urine production, helping the kidneys flush out excess waste products, including urea and creatinine. Additionally, parsley contains compounds that may help regulate blood sugar levels and lower high blood pressure, both of which are crucial factors that must be controlled whether you have chronic kidney disease or proteinuria. To make parsley tea, just take a handful of fresh parsley leaves, which is about 1 to 2 tablespoons, and steep them in a cup of hot water for 5 to 10 minutes. You can also use dried parsley if fresh isn't available, using about 1 teaspoon. You can drink 1 to 2 cups of parsley tea per day. If you prefer supplements, parsley is available in capsules or extracts, with a typical dosage of 500 to 1,000 milligrams per day, but always follow the recommended dosage on the product label. While parsley tea is generally safe for most people, it can interact with diuretics, blood pressure medications, and blood thinners like warfarin. Avoid taking your medications with parsley tea and talk to your healthcare expert if you feel anything weird after drinking parsley tea.